Doctors diagnose multiple sclerosis first by taking a good history of what's been going on in a patient's life. What symptoms have they experienced, over what period of time, have they had any of these symptoms come and go? And then the physical exam is also very important for us to try and determine, are there any signs in that person's body at the time of our exam that would lead us to think an MRI scan of the brain might further localize where a lesion in the brain could be consistent with multiple sclerosis. After we have brain scans, sometimes a lumbar puncture or spinal tap can help us determine if there are overactive immune complexes in the cerebral spinal fluid that would be indicative of multiple sclerosis. One of the initial things we do when a patient is diagnosed with multiple sclerosis is help them understand the disease, and it can be a shock to patients to learn they have a chronic disease. So helping them cope with expectations, what they can do in their everyday lifestyle to make their life easier, how to take medications to prevent the disease from progressing, and also to treat some of the symptoms are all ways I can help a patient with multiple sclerosis at the beginning and through the course of the disease. About 20 years ago, there weren't any good treatments for multiple sclerosis, and we've had a real boon in the development of drugs and biologic medications to treat multiple sclerosis. Some of our medications are injections, which you give to yourself anywhere from 1 time a week to every day. There's also 3 pills on the market for multiple sclerosis, and there is a once-a-month infusion that are treatments for multiple sclerosis to slow down the progression of the disease, to decrease disability, and to keep your brain looking healthy on MRI scans.